Hello, my name is Timothy Dionson and I'm a student at Western Governors University. Today I will be doing my video presentation on Application of Communication YJTtask2. A hammer, a drill, an electric saw. What if your doctor shows you the power tools he or she will use during the surgery but says, "Don't you worry, you'll be up and walking tomorrow and possibly go home the next day." And with all that, very little pain. It's possible. With the advancements of technology, instrumentation, and skills, surgeons are now capable of doing such procedures. Studies show that the anterior total hip replacement approach is advantageous over the standard approach because of this decreased post-operative complications and a faster recovery. Before I get to my first point of discussion, I would like to review the anatomy of the hip and indications for a total hip replacement. As a ball and socket joint, the hip joint is made up of the femoral head, the ball, and the acetabulum, the socket. The surfaces are protected by a smooth tissue called the cartilage and helps cushions the bones. To help prevent and almost eliminate friction between the two surfaces, a small amount of fluid which acts as a lubricant is produced by the synovial membrane. And lastly, ligaments, the hip capsule, provide stability to the ball and socket. A total hip replacement is indicated when a person's pain affects a person's activities of daily living despite conservative treatments, for example, physical therapy, medications, and assistive devices. During a total hip replacement, the damaged femoral head and acetabulum are replaced with a prosthesis. The standard total hip replacement involves making the incision through the back of the leg, cutting the muscle, the gluteus maximus, in order to access the hip capsule. While the anterior hip replacement, aka muscle sparing surgery, incision is made through the front of the leg, merely separating the muscle. This leads me to my first point of discussion. For my first main point, the anterior hip replacement decreases post-operative complications versus the standard hip replacement. Utilizing the anterior approach avoids cutting the muscles to gain access to the hip capsule to perform the surgery. Therefore, increases the stability of the hip and pelvis, decreasing the chances of dislocation. Also, with patients in the supine position, surgeons can ensure proper sizing and positioning by using live x-rays, therefore resulting in a longer lifespan of the prosthesis. A recent study shows that the anterior approach causes less muscle damage compared to the standard approach based on serum creatine kinase levels. Research suggests that the muscle-sparing hip surgery provides patients with a quicker recovery. Patients that undergo the standard total hip replacement must recover from the surgical approach and the hip replacement, while patients that have the anterior hip surgery only need to recover from the surgical procedure only and not the approach. Traditionally, after a standard hip replacement, patients are placed on a hip flexion restriction, typically 60 or 90 degrees. Doctors do this in order to prevent dislocation and allow the muscles to heal. With the muscle-sparing approach, patients are allowed to resume work and daily activities sooner without restrictions. Compared to the traditional approach, the incision is in the front, therefore patients avoid sitting on the incision that causes additional pain. With less invasive surgery, patients are requiring less narcotics. With less narcotics, patients reduce their risks of developing constipation, delirium, and other possible side effects. In conclusion, patients should need to be aware that with the rapid development of technology and instrumentation, there are now numerous alternatives to alleviate pain and better their quality of life. Patients should discuss innovative surgical treatments and alternatives with their orthopedic doctors, such as the anterior hip replacement, to expedite healing and decrease post-operative complications.